The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. This video is going to show how to assist a patient to the floor should they lose their balance while ambulating and you are unable to help them correct it. A gait belt serves as an important point of control. It is placed at the center of the patient's mass and therefore can be used to control how their mass is moving. It also prevents you from having to pull on a patient's upper extremities or clothing should they lose their balance. During a loss of balance, most of your assistance through the gait belt should be in the horizontal plane, not necessarily pulling up through the gait belt to keep the patient upright at all costs. Often, the best thing that a gait belt can do is to either help the patient correct minor losses of balance through horizontal corrections you may provide, or slow the patient down during a descent onto a lower surface. Anytime you need to pull on the gait belt, try to use a firm, smooth pull. A quick pull with excessive force may cause the patient and you to have further imbalance due to overcorrection. If the patient begins to lose their balance while ambulating, direct her towards you with your points of contact at the gait belt and shoulder. You should be stable yourself, assuming you are maintaining a wide stance while guarding her. Having the patient lean on you for stability will help you retard her descent to the floor. As you lower the patient, keep a wide stance to maximize your stability. Keep the patient's body close to your own so you are not keeping her at arm's length and straining your back. As best as you can, squat down as you lower her down rather than flexing through your spine. As you are lowering the patient to the floor, you may need to take small steps backward to make room for the patient as she sits down on the ground. If you do assist the patient in a fall, which is an unplanned descent to a lower surface, the patient should be assessed for injury prior to helping them rise again. Depending on the patient's status after the fall, they may be able to assist getting up. From the floor, they might be able to assume an all-fours position, then transition into a chair from a kneeling position. Alternatively, a mechanical lift may be indicated in some cases. Lastly, if a fall occurred, even if it was assisted and resulted in no injury, follow the policies of your facility in terms of completing a fall event report and a post-fall huddle so that staff can learn from the event.